Welcome back to the AI4 2022 Healthcare Summit. I hope you're all enjoying the show so far. Our next panel is titled AI-Driven Personal Care. Please join me in welcoming our panelists to the virtual stage. And I'll give it over to Justin, our moderator.
Hello, welcome everyone. Thank you for joining us today. I'm looking forward to our discussion. Got some wonderful panel members here, and we'll just start with really brief introductions. My name is Justin Smith. I'm at St. Luke's Health System in Idaho, and I'm the Senior Director for Advanced Analytics. And I think, Vi, would you like to go next?
Sure. I'm Dr. Antrum, Senior Vice President and Associate Chief Nurse Executive for Cone Health in Greensboro, North Carolina.
Who'd like to go next?
Yeah, I'm Elias, Abou Zeid, an Associate Director, Data Science within the AI and Deep Analytics team at Sanofi.
And hi, I'm Sudarshan Chitre, and CEO of KenSci. We work in the intersection of healthcare and advanced analytics, machine learning, and AI. So really excited to be here. Thank you for the invite.
Awesome. Yeah, we have a bunch of great questions to get through, and I'll say right away, I don't expect us to get through all the questions we've prepared. And so the first question, I think will pop up on the screen here in a moment. There it is, wonderful. So we're all talking and thinking about this, right? But we're talking about AI, but the true number of models that are in production varies widely. And so I think part of the question what we can discuss today is, how prevalent is AI in healthcare? And maybe we can each start with a really short definition of what we mean when we say AI. Sudarshan, would you like to go first?
Yeah, sure. Oh, so I think the way we at KenSci and myself see AI is really a lot more, maybe less glamorous than what AI gets talked about. Is we really talk about data and making decisions using data and really seeing what data has to tell us. And so we think more about machine learning, understanding context better, understanding the patient better, and as a result, being able to make better decisions. So for me, it starts from there, and then it can lead to a lot more interesting scenarios. But that's for me, like is what AI means. And if you want me to go into the question there a little bit.
What from your perspective, kind of what are you seeing for healthcare companies from your lens for how prevalent AI or machine learning models are?
I'm an optimist. I'm going to say that the adoption is fairly low compared to what it can be. And I think, but I do feel like there is an amazing shift in the last 3 years that I have seen in my interactions where there is a recognition that it is going to be adopted. It is getting there. And I think that the more and more I am interacting with data science teams within every organization that I talk to. That was not the case 3 years back. It was very rare. But I think there are still some real challenges to go into production, going to actually plugging into workflows and changing behaviors on the end user side to learn how to use ML and AI. I think it's slightly different than what people are used to. So I would say that there is a lot of adoption in terms of work towards using AI. There is in production, there is still some barriers there, both from technology side and from a human side. I feel like that we need to overcome over the next phase here to have a more widespread adoption.
Yeah, absolutely. I know in our organization we launched and operationalized right around 50 models or so, depending on how you want to count them last year, of which humans might see, say, 15 or 20 of those for like the actual human adoption portion. So it's one of those where there's a lot that are happening in the back end, able to really launch through and launch the machine learning. But what about Elias or Vi? Do you guys have any comments you'd like to?
Yeah, I wanted to add also, like, if we look in terms of market size, we can see that trend as Sudarshan was saying, like back in 2015, the size in terms of market was like, 800 millions. Now we see it in this year, it's close to 7 billion. And the market expert are actually projecting, and by 2027, the AI and healthcare market will be in the $67 billion.
Yeah, and I think for me, I think there is a wide variety of adoption in healthcare organizations across the country. So if you think about small rural facilities who maybe don't have the funds or the partnerships in place or the human capital really to be able to drive AI, and then you have larger systems that have very strong adoption for AI-driven analytics and healthcare management that reach the individual clinician, you know, perhaps managing a certain population within the healthcare system. And then there are other analytics and AI available that help organizations manage their community's health in some of those value-based care models. So I think there's a wide range of adoption, but I do agree with my colleagues that adoption is coming across the board. We will need this information to take the best care of our patients and our communities.
Absolutely. And I think that's a great transition, Vi, from the idea of communities. If we can get the next question, we're going to go from a large population right down to the idea of, I'll read it when it comes on. Wonderful. So define personalization in healthcare, right? How do you define that? What do you think about? And Vi, I think you got to go last. Let's go. You get to go first this time. If we're passing the microphone, yeah.
So when I think about personalization in healthcare, I think about meeting every individual where they are with the healthcare that they want to receive in the way that they want to receive it, right? And so right now, personalization in healthcare is really just starting, I think, to kind of take off, and it will be a lot of high touch personalization from a human standpoint in collaboration with technology. So when I think about personalization of healthcare, it is being able to meet every single person where they are with their needs. Some people want to receive care virtually and stay in their home. Some people don't have transportation. They need the care to come to them. How do we really use our AI to drill down and identify those different patient care needs? And I think future thinking, we would like to look at how do we anticipate how to keep our patients well and what their healthcare needs might become, but how can we proactively then manage our patients' health so that we can really start to drive care out of our hospitals and really keep people from getting very sick in the first place.
It's a powerful definition. I totally agree. I think the other example I like to use is, remember that as an individual, you're an N of one. And so all the statistics in the world are great, except for when it's me. And that's the personalization side of meet me where I am with how I like to be treated. And what am I looking for? I think that's a beautiful definition. Elias, you guys have anything? You have anything to add? Yeah.
Yeah, like for me, it is actually providing the most appropriate individual care based on the patient characteristic, let it be his genetic, basically, or even his environment, lifestyle. And that's actually to maximize, the efficacy of the treatment we're giving, while at the same time reducing as much as possible side effect and safety issues. And for us, like in the industry of pharma, it's actually what we call the big 6 rights. It's the right drug for the right patient at the right time, using the right route, the right dosage, you want to make sure from all these different perspectives you're doing the right thing for the individual.
Yeah, and I think if I had to add something, I think I agree with points that were made so far. I think one of the things that I would maybe add to it is, from an AI perspective, it's all AI in the end is local AI. And I think that the way to think about it is like, yes, there can be one model that is broadly kind of telling you some things, but eventually when it comes down, there is a need for the context to be local. And that's like the axis of personalization, the way we think of it. It's when you're adding more attributes, you're okay, for this condition, how would you treat somebody? But then you ask, but who, and what are their characteristics? And also when, as in the day of the week, who is giving care? What is the context in which, and how crowded is how many, there is all these other context attributes. When they are added into it, then I think that's how I think about personalization. Is it's not just about the person, but it's about the person in that very unique context. And if we can learn from the past and through machine learning and other places to know in this context for this person with their history and their unique condition, this would be the best way to give them care. And I think it's kind of all of those factors that makes it really personal at the end for that.
Yeah,
Both on the caregiver as well as on the patient side, I would say.
Yeah, for sure. We are not doing this. I'm very clear when I say this out, but I use this as an example for somebody outside the industry. And I said, imagine the day when you're able to, if you want, bring in your Netflix profile essentially to then help to drive how we communicate with you and engage with you as a healthcare system. Again, we're not doing that today, but something along those lines. I think that's exactly right. The contextualization of how do I want to be as an individual interacting or our patients, right? I think that's it's profound. And again, I think we see something along those lines coming down the pipe, but it's not quite here yet. That's a foreshadowing for a question that's coming up later for the audience. All right, next question. Let's see. All right. So how is the healthcare system currently approaching personalization of care? What about at your organization? Who wants to go first? This is an open one.
Yeah, sorry, go ahead. Go ahead.
Oh, go ahead, Elias. Yeah.
No, I wanted to say, like, for us as a big pharma company, we're actually, looking into these a new approach for drug development by using more personalized drug development based on using both the traditional, clinical setting data, but also real world data by combining different type of sources. Let it be electronic health records, using digital health technologies, wearable technology to collect data from the patient own environment, as well as bioimaging and omics data, and by using the traditional analytics approaches like biostatistics and machine learning, but also the more advanced deep learning and more advanced AI techniques.
Yeah, I think what I've seen regarding personalization of care at Cone Health, they're using AI in the radiology and imaging space. But additionally, during COVID, our enterprise analytics team was key to how we helped navigate the pandemic. So as different variants came out, they were able to use data from within our community and create different algorithms. And it really helped us understand how many patients were likely to seek hospitalization, how many of those patients would be in the ICU, how many of them would require ventilators. And so we were able to plan our equipment, our staffing, and our response using those numbers to either scale up or scale down to meet the needs of our community. And I mean, there's been a lot of talk about how COVID has revealed disparities in health equity. And we saw some data in our enterprise analytics information. And, for those who don't know Greensboro, the population has equal percentages of white and Black people in the community. And so when we started our vaccination efforts, it was imperative for us to be able to get some of those shots into Black and brown arms, and using that data to really kind of meet our community where they were, we were able to partner with local colleges, churches, bring mobile vaccine sites into different places within the community and go to the community, the entire community, to make sure that they were safe. We did town halls that allowed people to build trust. They could see people that look like them who have taken the vaccine. And so, none of that is possible without having the analytics, the data, the AI. That is really one of the ways where you can see this technology directly translating to improvements in patient and community outcomes. And we had 42% of our vaccines go into Black and brown arms. And so, that was an amazing outcome. And it was very intentional, but we were able to be so intentional because we had the information to be able to act on.
Definitely, it's great to hear that, and I think we have been fortunate to be able to work with some partners and customers to kind of help with some of these initiatives. And one example I'll give, and this is more on the personal side, but I definitely agree that on the population side, there's a lot happening to understanding the population, understanding the clusters, understanding how to serve certain areas differently than others within the network. But one of the examples I'll give more concretely is one of our partners and customers that we are working with. They were interested in predicting in a pre-op consultation setting, what would be the pain expectation and the range of motion post shoulder arthroplasty surgery. And so we work with them to build models that they could use during that consultation to decide not only like what would be the approach, give that some kind of an indication of what to expect in 2 months post-surgery, 6 months, 2 years, based on models, but also then in some cases to decide to not go ahead with it because the outcome was not aligned to what was expected or desired. And so that was I feel like that was an example of a very personal use of, does this make sense to me to do this when it is elective? And I think in those cases, it start to get a little bit more use where you have to have a decision that is to be made together with the patient and the caregiver deciding whether what to choose in moving forward. So that was very rewarding experience we went through, and we felt like that was a very effective use of data science and predictions for something real.
Yeah. Elias, do you have something you want to add? Okay, sorry. I thought I saw you going, oh, no, those are all, I mean, again, we're at our organization, my organization, we're discussing it. It's on the radar, but we've yet to really go into that level. And I would say, similar to Zeid's experience with, our last 2 years dealing with COVID, is that we've uncovered a lot of opportunity in terms of where can we apply this, and the tools and technology has been, I don't want to say hyper focused, but it's been a very large focus of our time and effort is to make sure our hospitals are adequately staffed, we have the supplies we need, and the patients are able to be cared for as best as possible. And I think that's been a really big focus. But at the same time, coming out or spinning out of that will be this next level of, okay, how do we meet people where they are? All right, let's see. Oh, yep.
I was just going to say, I love that, and that personalization piece, because really when you know one patient, right?
Correct.
And so as we kind of start to get there, I think the interventions that patients will have to choose from and truly become partners in their care and have a significant say over the care that they receive, AI is going to be a critical component of allowing that to happen and putting the power in the patient's hands.
Yeah, I totally agree. And actually, if it's possible, Patricia, can we switch to the question 5 next, and we'll go back to question 4? And the reason I wanted to do that is because this one, yes. So I think, Vi, you touched on this very, very clearly in my mind, but I want to ask the others as well. So are patients aware that AI is helping to play this role, or is it care as usual? And so when I heard your comments of saying we were going to go to those areas of the population we knew that may be disproportionately, favored or unfavored, or just have a difference in outcomes potentially, right? Did those patients know that or realize it? And I guess the larger question, which I'm interested to hear everybody's responses, do the patients, not do they care, but are they actively thinking about it? And the individuals I talk to from clinical settings, which is not very many, but when I talk to patients, they just say, I just want the best care possible. And I want to be safe and quality and, do your best job, please. And, so in the most rudimentary kind of conversation general ways, do patients care? Or are they just kind of like, yes, I want the best care possible? What are your thoughts?
Yeah, I think there's two type of AI. Like there's the AI that's more on the back end for data analytics, and that even in the past with the more traditional approaches, the patient wouldn't know about that, and that will continue with the more advanced AI. But we also have the AI that is, directly visible for the patient. For example, a diagnostic tool, let's say a wearable device that, monitoring your vital sign at home, and the algorithms are giving those alerts back to the hospital. So these are actually AI that's impacting the patient, and patients do have some apprehensions and concern about these technologies. I don't know if you're going to discuss this in another question, or you want to elaborate on this now.
Yeah, go for it.
So I mean, unfortunately, to date, we talk more about the technology. There haven't been a lot of engagement with the patient about these type of AIs. And then recently, some patients were interviewed about, AI in healthcare and what are the concerns they can see. And there was actually about 3 and 4 important concerns. One of them being basically, okay, now how it's exciting to see AI and what it can do, but how safe are these models? And also, are they gonna increase the charge for healthcare? Will the insurance cover these type of new technologies if the price is going to be more expensive? Also, how good is the data we're using to train these models? Because patients see in their electronic health record, sometimes it actually has wrong information. And we keep talking about using electronic health record to train our AI models. And also, like, are their data going to be safe if these models are using it and it's available across the globe? Because now we're exchanging data to have a more available and better access to data. So all these are like questions we really need to address in now and even going further in the near future.
Absolutely. I one word comes to mind, which I say often, is transparency. Right?
Yeah.
Sudarshan, what are your thoughts?
I think the question is depends on how the question is asked, and I think in general there is definitely overall skepticism around this robot that's going to treat me. In both sides, not just on the patient side, but even on the caregiver side, the concern that this black box magical thing is going to tell me what to do. But I think it's more about you were spot on. You said the patients want the best care that they can get. And if you ask the question like, do you want your caregivers to be more informed or less informed about yourself and possibilities of outcomes that could happen based on? So the answer is the technology is going to keep moving forward, and patients are going to expect more awareness from the other side about themselves. And I think it's just the fear of the unknown a little bit as it becomes more. Consumers are dealing with AI outside of a hospital setting all the time and getting more and more comfortable around, and actually they benefit from it. And I think it is going to get to that comfort level. But I feel like the technology has to also play a big role in making it safer and doing AI in a responsible way. I think it's on the technology products that are built to build that trust, to be very careful about the way it is applied, and it is not the same as you applying it in e-commerce. And you got to think about it for domain specific application of AI. And I think there are some very clear things around trust building, which is explainability in everything that you predict. So you have to have like, this is what I think is potentially going to happen, but here's why I think that has to be associated with it. And so then an expert can look at both of those things and then still on top of that make a judgment call. So there is a level of protections there, not just following what machines say, because a lot of the data is not yet dependable, and that's scary. So I mean, I think that trust has to be built, but it's going to come from everybody playing their role in that, and we're going to get there.
I think this is another question that I would say there's a high degree of variability. I think younger consumers who've grown up with technology probably feel more comfortable with patient portals, with remote monitoring and wearable devices and things of that nature. And then you have what I will call more of our traditionalist generation who typically they will follow the recommendations of their healthcare provider. So if my doctor said it, it must be true. But I think in the middle there, where you have, maybe the more baby boomers and Gen X, there's some skepticism there. And I think Sudarshan hit on it exactly, that the reliability and the trust isn't entirely tight there. And people are cognizant of their licenses and going to school for a long time. So from a clinical perspective, I think, there are a number of clinicians who still want to be able to exercise their clinical judgment and sort of have some resistance on that. And then you have some patients who, say, I want the best care no matter what. If AI can give me the best care, please do what you've got to do. But there will be other patients who are extremely private and really don't want to feel like their information may be out there, or that Big Brother is watching, or things of that nature too. So I do think there's a strong variety of reactions from our patients in regards to AI. And then I agree with Elias too, that a lot of our patients don't even realize how AI is directly impacting their care because they never see it, they don't know about it. And I think even, the government has tried to step in with the Cures Act and things of that nature, where patients have more access to their information sometimes before a clinician has an opportunity to go through it with a patient. So, I do think we're in a bit of a gray zone, and different people are in different places. So you've got that whole bell curve, and people are on different parts of that bell curve.
Yes. One of the things that I enjoy discussing with both clinicians and with patients is the idea that AI, in my mind, right, should never supersede clinical judgment or critical thinking. So we want the humans to do what humans are very good at, which is what they've gone to school for, what we're experts in. And we want the computer, the AI, to do what it's really good at, which is being, and not in a creepy way, but being everywhere all the time to be able to monitor, because I like to go to sleep. Right? Our physicians like to go to sleep. Our nurses like to go to sleep and rest. And so while we have, our human capacity to do great work, we can help and work kind of with, it's almost like the idea of a partnership role, right? With what are we good at as humans and what is the AI good at, and how can we leverage both to their maximum capacity? And when I explain it that way for patients, they're a little less concerned, but at the same time, we have a long way to go for our education. I think both internally and externally, to say, this is how this technology can benefit us, and how we are, again, in the healthcare space, we want to be using it for the optimization of health for our patients, which I think is a very easy train to get on board from my perspective. Nobody says I want to be less healthy usually. Fantastic. Let's see. We've talked about this a lot. This is a bunch of, you'll hear the words I'm sure we're all going to say again in this next question. But the idea with this one is, what are the challenges, right? As we work towards more personalized care. And I think every one of us said data. I didn't say it yet, but I'm going to say it out loud now, right? So our data access, data quality, data management, the big giant elephant in the room that we all talk about often is data governance. Right? When I say risk, what do I mean? When you say risk, what do you mean? Or my other favorite word to say and then leave a meeting, I don't do this, but is acuity. And then you walk out of the room, right? Everybody's arguing over acuity. And so I think we have a lot of challenges from the data perspective side that, again, in healthcare, we have such diverse data sources that we're working to kind of collate and make as best as possible. And again, I think the idea too is we look to other industries often to say, oh, they're doing a fantastic job. But manufacturing, they've been collecting very standardized data for decades now. And we've recently switched to where I say this, kind of half jokingly, but not really, is you can still walk into almost not any clinic, but many clinics. And if you look around close enough, you'll find a paper chart somewhere. Hopefully nobody's really using that, but it's still on the wall. It's in a shelf. Right. So paper charts are still alive somewhere, and we're still working to switch and transition fully to this, EMR level of data collection across all levels of the health system. But again, what are the challenges that you see or you guys are facing specifically kind of in your roles? I don't know who wants to go first for this one. Sudarshan, maybe you want to go
Yeah.
first. Cool.
So definitely, I think we have been on this journey of bringing advanced analytics, machine learning, AI to healthcare over now 6-7 years. So we really thought about this problem quite a bit, just because we are in this space. But there are like four primary things where there is friction. I would say that results in challenges of very wide adoption. And I think we talked about data. That's one of them. Data heterogeneity is a big problem. Data quality is a big problem. So I won't. So you did a good job of describing that. But I think there are three other things that we do face. And I think we touched a little bit upon the first one, which is building a model is not the same as plugging into the workflow to have it in the right place at the right time to use it. There is already an overworked workforce who doesn't need 4 more screens to look at. There is some real problem between bridging the gap between being smart and intelligent about predicting something, but then actually bringing it to the right place to make it useful. So I think that's an adoption, the user side of it adoption. But the two other things are, from a business perspective, it is very hard to attribute credit to AI. And as a result, it becomes one of these things that people want to use, and it's great to use. It sits in that innovation side of the organization. But for it to be widely adopted, it needs to be able to stand on its own merit for ROI, very clearly saying we did this and it benefited in this clear ways. And just fundamentally, it's an ambiguous space. It is not a rules-based direct transaction. So, and especially if you're trying to predict adverse events and then you avoid them, your prediction is essentially wrong because you predicted it will happen and it didn't happen because you did. But it's kind of this confusing thing whether was it the 15 other steps after it that made the difference, or was it the prediction? And I think the fourth one is a very fundamental thing, which is responsible AI. I feel like safety nets are what will make it widely adopted. If the data is bad, the prediction needs to shut off on its own. It can't be a human understanding that complexity that something is not right here. I should not be giving this prediction to this patient because I should auto shut off this and say that, hey, sorry, but I don't feel good about giving you a prediction right now because, and I think there are a million those small little controls that are going to be needed to the system to get to a place where people can start to trust and reliably use it, because they don't have to worry about what if it's wrong, what if it's horribly wrong. Because I think the problem with AI is and ML is when it is wrong, it is really, really wrong. It can be completely absurd, right? And like to your point, critical thinking is not there. It is just data and algorithm based. And so I think that safety net scaffolding where people feel safe about using is a very big challenge. So I feel like those four things are like the things that are getting better, but those are still the fundamental friction points, I would say, for wide scale adoption.
Agreed. Elias, what are your thoughts?
Yeah, I also wanted to add, it also depends on the environment where we're using that AI model. For example, we all build model in the lab and we tested on data, and it could give you high accuracy in the 90s or whatnot. But sometimes when you're using it in an environment that it wasn't meant for, it actually gonna start failing, and you're gonna see bad decisions. So I see AI actually as something we have to be in a closed loop where you continue monitoring it while it's being used in the clinical environment, and continue adapting, improving the system, both the model and the system it is used in it.
Yeah, I think the things that I would add as additional challenges, one, qualified people who can help build the AI and manage it within your organization. So I think, there's not a lot of people out there with the skill set of several of you on here. So you are a slim commodity. So I would say that is one challenge. I would say another challenge for AI is its ability to integrate seamlessly with already existing IT systems that are used within the healthcare setting. Because if we're going to ask clinicians and people at the bedside to access yet another system to add extra steps into their work versus making it more efficient, it will not be adopted. And that's just the bottom line. time for that. So I think making it streamlined, efficient, that interoperability piece is very key. And then I think, the other piece that I would add is just the ability for it to improve the workflow and the outcomes of both our patients and our staff. So when I think about AI, I don't just think about the patients. So for example, in China, they're using robots on some of their nursing units that can help reduce some of the tasks that our nursing techs and our nurses have to do. And what that does is it allows clinicians to have more time with their patients, which is why they went into healthcare to begin with. And that brings joy back into the workplace for our staff, but it also improves patient outcomes because now they have time to spend with patients, going through their information, educating them on different topics, finding out what their goals are for their care, and for, whether it's in the hospital, whether it's in the ambulatory space or out in the community. What are your goals so that they can be incorporated into the care? And so in that way, it improves, strengthens, and enhances the bonds between patients and their healthcare team.
These are phenomenal answers. There's a loss for words there from which isn't usual. So Vi, I want to switch to our last question, and I'd like you to continue with your thought process for us in terms of what you're seeing now from the challenges, but where do you see it going, right? What does the cutting edge look like of personalization, and then where do you think we will be? And let's push it out. Let's say 5, or let's just go a little crazier and say 10 years from now, right? World is a very drastically changing place, but what's it look like in kind of that mid to long term, from our perspective, 5 to 10 years down the road?
Okay, so if I was going to dream big on that, what I would love to see is that, people have their healthcare and well-being needs actively anticipated, that they are engaged with our healthcare system as a trusted provider, not only during their times of illness, but to help prevent them from ever getting ill. We have to think about things like making sure that there is high-speed internet access in all of our communities so that everybody has the opportunity to access and leverage the gains that can be had from AI. But, when I think about hospital at home programs, right, things of that nature, this is really, now I don't have to listen to dings and beeps all night, right? I can get my care at home, the same kind of care that I would get in the hospital. I don't have to be confused by the setting. I'm gonna like the food because it's the food that I want to eat. All the little things that people kind of think about. And I think AI can be transformative in really helping us break down those social determinants of health, to collaborate in new and better ways with our communities so that each person, health and well-being, when you tie those two together, it's really not just about your healthcare. Do you have a safe place to live? Do you have food to eat, right? Are there green spaces where your kids can go out and play? Is there affordable housing? And is there access to jobs? Do you have transportation? All of these things matter. And so as we start to think about personalizing care, it's really about reaching everyone. And 5 years from now, what I would love to see is a case where our clinicians are no longer tied to their workstation on wheels. They can just carry a phone, they can scan their medications, they can do everything that they need to do, take pictures, whatever, right from their phone, so that they can spend lots of time with their patients and not a lot of time on some non-value added things. And then I will preface this and say, in order for all of those type of things to happen, I think really we need people who are lobbying and advocating on the local, state, and national levels to make sure that the healthcare environment is as regulated as necessary, but not overly regulated to the point that it cripples our ability to be able to provide quality care to our patients. I think the documentation burden on our clinicians has really kind of led to burnout and people actually leaving the healthcare setting. And so as nurses and doctors and others leave healthcare, that really doesn't do a lot to improve the health of our individuals or our communities. So I'll stop there so others can add. I could keep going, but
no, it's fantastic. That's awesome. We have about 5 minutes left, so I don't know who wants to go first, Elias or Sudarshan, but go ahead.
Yeah, I'll be brief to give some time to Sudarshan. So I will see basically in the future, we're going to have more abundant data, you know, with all these digital health technologies, wearable data, we'll have more data focused on the individual, and we will be able to make better assessment based on these big data. And because also I see in the future, we'll have connected tools and platforms, data can be shared across organization and even countries. So all this will empower, you know, the doctors and nurses to actually have access to a lot of these information, as well as the most advanced results, to be able to focus mainly on giving the best quality care for the individual.
I'll take 30 seconds. I think everything has been beautifully said. So I agree with everything I heard, and I'm excited about it. I would say that the bigger shift is the reactive to proactive. Think about wellness. Think about how can we live better. And I think that if technology can play a role in getting us there, I think that's what we should be looking at. A lot of care happens outside the four walls of the hospital. More and more we're seeing this. And I think if we can do things to deal with problems there. And then the second thing I'll say is that our caregivers we need to create room for them to go to a level above in the way they care, not in the nitty-gritty and the button clicking and things, but actually to caring. And I think we'll get a lot more high quality care. Also, our problems with, especially with mental health and other things, are getting more complicated, and they need to have a lot more focused thinking and different ways of healing. And I think directionally, I would love for us to kind of be able to go there and as soon as we can. Maybe next year, not in 5 years.
Absolutely, we need a faster timeline. No, I think my thoughts exactly. I think we're all describing a very similar future that we're building towards. And I would just add that it's the idea of the technology will be highly integrated, meaning your omics data, your personalization of what are your behaviors outside of the health system, kind of your social determinants health will all be rolled into kind of the future state. And then also it'll be ubiquitous, meaning I just used the example recently that it's like rotary phone. Some of us remember a rotary phone. You had to make a phone call, you had to dial the rotary, you didn't know the number, and all this stuff went into making one phone call. Whereas now you pick up your device, I don't know anybody's phone call anymore or phone number. I just swipe over and push a button and all that stuff is now known. I don't have to know it anymore. I can reduce my cognitive load to focus on more human behavior and human activities. The contact, the face-to-face moment when you don't have the provider who's looking over at their monitor screen, they can then sit and look at the patient to provide that care. And that's, down to the most kind of, in my mind, humanistic personalization is having that one-on-one interaction with your caregiver from a patient and provider perspective. That's what we want to be doing. So I think we're going to wrap the panel up now. If we're doing good on time, I believe. I just want to say thank you to everyone who came and arrived and listened and participated. And I appreciate all of you on the panel as well. It's fantastic, and I look forward to having this conversation kind of as we go into the future and keep it alive, because we're moving towards that goal of better healthcare in the future.
Yeah. Thank you, Justin. Thank you, everyone. It's really a pleasure.
Thank you.
That was incredible. Thank you all so much. A big virtual round of applause to all of you, and a special thank you to Justin for moderating and keeping us on track. This has been an incredible conversation, and I know the audience is going wild. All right, for the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our awesome exhibits. Thanks so much, and we'll see you around.
Bye-bye.